Joining us now, Republican Senator John Barrasso of Wyoming. He's a physician. He's also a member of the Foreign Relations Committee. Senator, thanks so much for joining us.
Thanks, Wolf.
Are you with Senator Graham and Senator Cassidy?
Well, I am. I actually want to get the decisions out of Washington back to the states to let people decide what insurance works best for them. It's a way that they can find much cheaper insurance, more affordable insurance for them, and give them more control over their health care, because what Bernie Sanders is explaining there, that's Obamacare. This inefficiency, the bureaucracy, all of those problems relate to Obamacare.
The notion, let's get back to what Senator Graham and Senator Cassidy are proposing. Does that have to be passed before the end of this month if you can do it with a simple 51 majority or 50 majority if the vice president gets involved, or do you need 60?
Well, you need 50 till the end of the month when reconciliation, the issue, passes on. But otherwise, you can do it with 60 votes. But I think it's a good idea to get the money and the decisions back to patients out of Washington and let people decide what works for them.
And you think there are Democrats who are going to join you in supporting this, what some are calling a Hail Mary?
Well, Chuck Schumer has been very clear that they like Washington in charge. They want Washington to control the money. So I'm not expecting many Democrats, if any, to join us.
So so realistically, it's not going to go anywhere.
We're continuing to work. We probably have 45, 46 senators who are ready to vote for it now. We need to get to 50, and then the vice president, we're continuing to work on it through the end of the month.
What's wrong with Senator Bernie Sanders' proposal? He's got about 15 other Democrats who have now co-sponsored this new legislation to allow the United States to have a health insurance system along the lines of every other industrialized country, whether Canada or Britain, all the countries in Europe, other countries around the world, that there's comprehensive health insurance guaranteed for all citizens.
Well, first of all, this is truly the litmus test for the liberal left, with all of the Democrats who are looking to run for president in 2020 signing on to it. The issue is, the bumper sticker's pretty good, but when you get into the specifics, the details, the nuts and the bolts, what does this actually take from someone? Not what does it give them, what does it take from them in terms of the money? They've tried to do this other places, they've tried in the state of California, even in Bernie Sanders' home state of Vermont. They got rid of it because they realized the cost would be over twice.
But it works well in the UK or France or Canada or other countries. You get sick, you don't have to worry about health insurance. You go to the doctor of your choice, and you get treated. If it works well in all these other major industrialized countries, why wouldn't it work well here?
It depends what you describe as work well. If you're a patient in England right now, realizing that the numbers are so bad for the amount of time people have to wait for an appointment, emergency room waits spiked longer than a 12-hour delay. If you have a chronic condition, 18 weeks before you get to see the doctor. In Canada, where they talk about the free care, as a surgeon in Wyoming, I have operated on people from Canada who can't afford to wait the time for their free operation. There's articles written, leaving Canada for health care. And many are coming to the United States, even though it's free, because in Canada the waits are so long. And once they spend a certain amount of money, cataract surgery, total joint replacement for the year, they cut it off. And usually that's around Halloween. It's why they call Canadian medicine trick-or-treat medicine.
What's wrong with having a system where you do have guaranteed Medicare, let's say Medicare for all, for everyone? No one is going to go without health insurance and medical treatment. But at the same time, if you can afford it, you have private insurance at the same time, and perhaps you can get some better treatment. What's wrong with a double-tier system like that?
Well, for senior citizens right now on Medicare, and we want to make sure we have a strong, secure system for them, I think this undermines their ability to get care. Many doctors don't want to take...
They're happy right now, the seniors who are on Medicare.
Those that can find a doctor.
It's a system that works for people in the United States who are 65 and older.
It does work for them.
Why not expand it for those who are 55 and older?
Because fewer and fewer doctors want to take care of Medicare patients because the reimbursement from the government is so low. I talk to hospital administrators, and they're saying we lose money on Medicare patients. So to do that across the board, you'd look at more hospitals consolidating or closing, and you'd undermine, I believe, the integrity of Medicare for our seniors, and that's who it was designed for. My mom's in her 90s now. The year she was born, life expectancy for a woman in this country was 56. Now it's 81. So when you go back to the old speeches of Lyndon Johnson and why they wanted to do Medicare, it was for the widows, because most of the guys by 65 were going to be dead when they set that age at 65. So I want to make sure that Medicare, which is currently being stressed financially, is there for our seniors. And I think what Bernie is proposing is going to undercut the integrity of the program.
It sounds like we should have a debate between you and Senator Bernie Sanders on this issue, Medicare for all. It could be an important discussion. What do you think?
Well, we could do it in a university, have an audience there. We could do it at on CNN live.
You could do it on my show. We can invite Senator Sanders. I'm sure he'd be ready to. And your office and his office, not too far away
We're right down
in
the
the
hall
U.S.
from each
Senate.
other.
So it might be a good opportunity and educate the public on
the
your
differences.
position and very important differences between what he is proposing, and he's going into great length. And he's getting a lot of Democrats who are on board with him as well right now.
Any Democrat wanting to run for president in 2020 better sign on with Bernie, because that's where the liberal left is going.
All right. We'll have a good conversation. You have accepted the idea. We'll ask Senator Sanders as well. That's it.